Okay, good afternoon, everyone. Good afternoon, fellow data scientists and then our enthusiasts.
Good afternoon.
Yes, so we're about to begin our meetup, and then we'll start by introducing ourselves and then maybe telling us something about where we are joining from and also expectations for today's meetup. I just spoke to Dr. Napoleon, and he will be joining us soon. And also Rotovo too will be joining us soon from from Cameroon. Yes, so today's agenda is simple. The first session is about networking. That's where we get to know ourselves and probably know what we do. And the second aspect will be the speaker will come in and then take us through his topic. And then the last session will be a closing remarks by the founder for Cameroon User Community. Yes, so let me start. So I'm Francis Mensah. I'm a statistician, data scientist, a programmer. I do quite a lot of things, but for now, this is what because of R, so well, RSIC, that's what I do. And then I also work with VectorLink, PMI, as an M&E officer. I also run a cosmetic company, where we do some products and then we export it and also do some within Ghana. I also help people when it comes to PhD and then MPhil. I have a team that does that. Yes, so this is just something short about me. I have a consultancy firm called Chemistry International, where we do trainings on the other softwares apart from R. So SPSS, MATLAB, RedCap, NVivo, Stata, Power BI, Quantum and ArcGIS. So we do a lot of stuffs on training. Yes, so this is just something brief about me. Currently, I'm in Tamale. We are working on the vectoring project. By tomorrow, God willing, I'll be in Kumasi, and I'll be there for almost 4 months before traveling to Accra and also back to Tamale again. So, so this is what I do. So let me move to Jonas. Kindly tell us what you do, where you are joining us from, and also let us know more about you so that we can always network and then do some things together, maybe on this project or something.
Yeah. Okay, my name is Jones, as you rightly indicated, and I'm also based in Tamale, works at the Tamale Teaching Hospital as a nurse, and I also a student of UDS, that's a Master of Public Health, specialty in the epidemiology and biostatistics. So I'm currently a student and a staff of TTH. Thank you.
Thank you very much. Thank you for introducing yourself to us. And I think we have Lily. Was it Lillian? Lily, Christina, Anna, if you can introduce yourself to us, tell us where you are joining us from.
Alright.
Let us get to know you.
Okay, please, I hope you can hear me.
Yes,
Please, can you hear
please.
me? Okay. All right. My name is Lily Anan. I'm currently a master's student at KNUST reading water resources management. There's something related to public health, so I wanted to join in to see what I could benefit from this. So, yeah.
Okay. Thank you very much, Lily. And then we have Laura Equia. Can you let us know where you're joining us from and your expertise? Hello, Equia. Okay, so Edwin.
Hello,
Okay, hello, Equia is back. Okay.
I'm listening from Adenta. I saw the flyer on the page and I decided to join.
Yes, so this is Ghana Arusha community. Normally, we organize meetups. So meetups is just a way of learning. It's just like workshop or webinar. So what we do is that the Arusha community, we are very big. We are in all the countries in the world. So the meetup then is just to help us get to know ourselves, get to network. In case you find yourself in any of those countries, you can contact those other communities. So we have a lot of communities. We have the Nigeria, that's Abuja. We have Ibadan, we have Lagos, like there are many. And those normally we do it in cities. We do it in cities basis. So we have Kenya, we have the Nairobi, we have the Johannesburg, we have the Namibia, we have the Botswana. We have a lot of people who are also running similar meetups in the other African countries. So normally when we do these meetups, we try to connect with the other countries. We have Paris, we have USA, and currently there are lots of conferences happening. There are lots of workshops happening. I normally join online because of my busy schedules. I join online for some of these conferences. Yes, so and meetups are always for free. Yes, so this is what we do when we have these meetups. So as I said, this is just an introduction session. Our distinguished our speakers in, so we'll just do the intro before he comes. So I just want us to first of all try to do the networking, because I believe that anything you do in this world, networking is very important. So once we get to network and we get to know ourselves, it helps. Yeah, so I think Ikuya, yes, so I was trying to explain certain things to you. So I think, so we just want to know where you are connecting us from, what you do, then your expertise, that's all.
I'm in Andenta, and I read biochemistry in KNUST.
Okay. Okay, thank you very much. So Edwin, I don't know whether Edwin is on. Edwin?
Yeah, good afternoon, everyone. My name is Edwin Kumado. I'm joining from Nairobi, Kenya. I'm currently doing my master's in statistical science at Strathmore. And yeah, I'm an R enthusiast. Anything you can use to do R for, you'd find me joining to learn about it. Thank you.
Okay, so Nairobi, I think Shell Karuki is the one champion in Nairobi. But I think of late, I think she has gotten a contract in the US. And I don't know, she's not all that active nowadays. But I believe that the Nairobi community is really doing well. And even currently, Shell is even the founder, or let me say the main director for the African Arisa community. So I work with Shell. So maybe I'll try and see whether I'll talk to you. I'll talk to you maybe later then. Maybe try to link you guys up so that as and when they have their meetups, you can join. I know they also have groups that they do this meetups. Okay, thank you, Edwin. And then
Thank you, sir.
we have Theophilus before we start. Theophilus, where you are joining us from, your expectation and your expectation. People are introduced about your speaker.
I'm Theophilus Zuma, joining from Volta region, research assistant at the School of Medicine, University of Health and Allied Sciences. I'm also a member of our user community, and I've joined several programs and some trainings, and I'm hoping that this program will also help me polish up my skills in using art. Thank you for this opportunity.
So I think we can start. Let me introduce our guest speaker. I think
Hello. Hello.
yes. Okay, so we can start. Let me introduce our guest speaker.
Hello.
Yes, hello, Theophilus.
Yeah, please, have you heard me?
Yeah, I can hear you.
About my introduction, I don't know whether my network was okay, so that's what
My network went
you-
off. Okay, so you can just reintroduce yourself again.
Okay, I am Teflo Zuma, joining from Volta region from the University of Health and Allied Sciences. I work as a research assistant. I am a member of Ghana user community and I've joined several programs. We have the mentorship, various mentorship programs that I've joined, and I'm joining this one with the hope that to polish up my skills in using R. Thank you very much for the opportunity.
Okay. Okay. So I think our time is far gone, but then I can see my very good friend from Cameroon. Ratuvo, I don't know whether you can just introduce yourself and let us know where you're joining us from, what you do. We are in the networking session.
Yes, good morning, colleagues. My name is Avo, and as he said, I'm from Cameroon. I am a statistician, and currently I'm working for the United Nations, supporting monitoring and evaluation. I'm mainly working on food security, but sometimes we have also projects on health and education. Thank you. Over to you.
Okay, thank you very much. So Avo is the leading member or the founder for the Cameroon Ad User community. Yes, so I think we can start. Yes, so let me introduce our guest speaker. So our guest speaker is a respected statistician, an epidemiologist, biostatistician, and data scientist, deputy director of NIHR GSU Ghana Hub, and a manager and a Ghana data center. And manager at Ghana Data Center. Let me just be snappy. He's the HOD for Medical Research and Innovation, SOMUDS, certified counselor. Dr. Napoleon is also a member of the Ghana Aristo community group or community. He's our community executive advisory member. And then he has done a lot of researches over the years. I think there's a lot to say about Doc. If I want to continue, I wouldn't finish, and time will leave us behind. So Doc, over to you. Maybe Doc could do our honors by introducing himself to us.
Okay. So let me maybe let you see my face. Is my face seen? Are you all seeing my face?
Yes.
Yes.
Oh, is that so? So because of network challenge, as our lead for our community, Ghana has introduced in the person of Napoleon. I am a staff of the university, and I teach statistics, I teach biostatistics, I teach epidemiology, I teach data science. So today, I think it's Cameroon, right? Our community that would want us to be, showcase in terms of what R can do. And so I have prepared a topic on R. But this topic is in two folds, the R for analysis and R for prediction. Well, we will do some kind of R display, but the way I see it, if you don't explain survivor analysis, it becomes problem to display it in R. As for R, anybody can do it because once you give it command, it must give you results. The output must be there. But what is important is at least what you want to do, get a basic understanding, and then you move from there. So basically, we are going to look at R in healthcare data. And of course, why do you think there's the need for us to use the R? So permit me to off the video, perhaps it may interfere with my network. Okay, I hope I'm permitted. Hello,
Yes,
can you
please.
hear me?
Yes, please. Loud and
So,
clear.
okay. Good. Now, why the use of R in healthcare data? You all bear with me that the fact that healthcare is really a force to reckon with, and our SDG, equal asset, in fact, healthcare for all. And there are so many data being produced and churned out as far as our healthcare delivery, healthcare evaluation, our healthcare performance. In fact, the healthcare in totality is concerned. There are data that we generate, and these data sometimes come in a large volumes. So it is more expedient and more better and good, or it's better for us to get a software that is so robust and will be able to handle these data in terms of volume, in terms of speed, and in terms of what have you. The R is able to handle that. And again, too, R is able to do that, not just because in unforeseen circumstances, then R comes in to do what we want to do. No, we are saying R is preferred because R is an open source and free. So you can just download your R and install it and begin to work with it. So in that sense, it makes you able to handle the data. There are some software you buy them. And then with its rich ecosystem of health-related packages, you cannot run R without using packages. And of course, the packages, I would say they are always the indicators that would get you to where we want to get to. So if you have a special measure to do, or what you need to do or look for is the kind of package that will aid you in unravel whatever mystery you want to do. So sometimes I will want to do graphs. And of course, are there packages that will help me do graphs? Then I look for them. They are there. So one, it's the embodiment of 8 packages, which I will say they are rich ecosystem and they are health related. Then we can look at the excellence for data wrangling, stars, and visualization. When R gives you its output in terms of how to massage the data, it is so superb. The wrangling nature, the statistics, and today we'll be specific handling what we call the survival analysis. And then the predictive models, but the predictive models, I may not do much because maybe with time, but in a due time, we would also look at that. But I will show you what it is and what is needed. And visualization, of course, decent and very quality drawings and graphs and charts can be done by R. So this is why we want to use R for our work. And that is why we are users of R, because of these advantages and its robustness. And we are to look at the survival analysis. When we talk about survival analysis, that we want to use R to apply. What exactly are we talking about? There are 2 ways, survival analysis. So we are looking at your surviving trend. In other words, how can I analyze my surviving trend? Also, it means that there are issues that there can be survival And if this is a survival, then the question now I ask is, how do I analyze that? You see, it is a branch of statistics. And what it does is, survival analysis is a branch of statistics, and what it does is to study the time until event happens. So, for instance, if our community has so many workshops to do on R, then right from the time our community starts the advertisements and the time these workshops on R come on, then you look at a survival from the time of advertisement to the time of what? The implementation of the workshop. So for hours, you will imagine the time they started showcasing or advertising for this program. So right from the time to the time that the, what do you call it? The workshop is done. Through that period, we can say that it is a time period until an event happened. And anytime we look at that, the time period up to the point where the event happened, then we are talking about survival analysis. So anything with time and steady within a period qualifies to be a survival analysis. So you see that when you are looking at survival analysis, I can look at an event. Of course, all of us know event. Event is a point thing, one point thing. It doesn't travel. It is just a matter of what is happening, what is the outcome. So it becomes an event. So death is an event. Diseases relapse is an event. A matter of diseases reoccurring is an event. When something fails, equipment failure is an event. You go and resign from your work, it's an event. So you define or you study the time from which maybe you got the employment to when you tender in your resignation. That will constitute survival analysis. So survival analysis, it cuts across in so many areas. First, in schools, in business, in the health sector, in economics, in crime, and what have you. You can just get these ones there. And then so we look at, anytime we're looking at survival analysis, we can look at analyzing the time to event data. That's what I have taught you, that the time you start, like our presentation now, the time they started advertisement to the time that we are giving you the event, or we are giving you the implementation, is what we call the analysis of time to event. So anytime you are handling survival analysis, ensure that you have data of such. If your data does not suit that format, forget it, you cannot run it. Then you have way of handling census observation. Then common in clinical trials and epidemiology. So these are common in epidemiology, clinical trials, because our topic is on health. That is why I am much particular looking at illustration from clinical trial. But let me school you through a certain angle. Maybe you get that explanation properly. Now, let's look at a scenario like this. Imagine you are planting seeds and watching to see how long it takes for each one to sprout. Now, what that means is that we are looking at the seed. We are looking at each of them when it was sprout. Now, do you bear with me that some sprout quickly, some will sprout quickly? Is that not the case? Because when you plant, some may bear the flower quickly. Some too will take a long time. So look at how the pattern of survival analysis now coming. Some will sprout quickly. Some too will take a long time before it sprouts. Some never sprout before your experiment ends. Because my experiment is that I am taking an observation of how a seed, so I'm watching them, will take a long time for each of them to sprout. Then I'm giving you a scenario. There's a scenario that some may sprout quickly, some may take a long time before it sprouts, so within the time. And some never sprout before even you end your experiment. You are tired, you have observed that it's not sprouting, so why? I've ended it. Some pots get knocked over, some too are destroyed. Not that it didn't sprout, it is destroyed. Because you don't know what happened to them. So in this case, a situation where you are observing a seed as to when it will sprout, and then you get to a point, where some will sprout quickly, some will not sprout at all. Some too will not sprout till even after you have ended your experiment, still not sprouting. Or some too would inevitably be knocked down without even knowing the cause. So survival analysis now helps you to analyze all that data, even when you don't observe the event for everyone. So even if you are not observing the event for all of them, survival analysis will tell you what is happening. And so bear in mind that there is what we call sensor or censoring. The censoring is telling you that they didn't fail yet, but you don't know when or if they will. So for instance, what I said, that there are some events, like the sprouting. I'm using the sprouting, for example, before I use the health. There are some, even when you have ended your experiment, they have still not sprouted. And when it happens like that, it is called censor. Now, in health, maybe you are looking at how children are malnourished. So they diagnose the children to be malnourished and the time period it will take for them to die. This is what we call the survival time. The time it takes for them to die. And that is what we have explained. So in this case, you will see that a child is diagnosed with malnutrition. Yet, when the experiment ended, this child has not died. He is still there. So when that happened, we call it censor. And in survival analysis, you will need a survival time. That is from the time the diagnosis to the time the death happened. When that event is what we call the failure. So the event is the death. And the census is when we go beyond your experimental endpoint. I hope it's clear. Now, so the survival time is the time until the event happens. And then we can talk about the survival functions, the probability that the event hasn't happened by what? Time. So that is also there. But now there is something called Kaplan-Meier estimator. Kaplan-Meier estimator. What it does is that your survival analysis you are doing, it gives to you in a form of a graph. And the graph is a stepwise graph. It tells you the survival over time. So at every point, how many people have survived? At every point till it is done. So in survival analysis, we need what we call survival time, event, and censoring. And then we need to plot our survival curve, which is called the Kaplan-Meier estimator. And that science, it tells you or shows you the survival over what? Time. And then we have another magic, which is called cost proportional hazard model. What does it do? This is a regression model or a regressional tool or regression tool to find out which factors affect the survival time. Yes, we have seen that in terms of diagnosis to death, there is, what do we call it? Reduction in, what do you call it? Maybe survival with respect to time. But then what are some of the influencing factors? Is it the age of the children, or is it the feeding, or is it the parents? So if you want to know the factor that are affecting them, then we can talk about the hazard model. This one, it seems I'm not even giving a talk, I'm giving a lecture. So the survival time data, this is it. We measure the time to an event of what? Interest. The occurrence of the event is typically called a failure. So from diagnosis to death, malnutrition from diagnosis to death is called what? Failure. But the death is what we call the event. The event. An observation is censored if we don't know the exact time of what? Failure. I've said it. If we don't know the exact time of failure, and I've told you that failure is the occurrence of the event, the death. So from the time you are diagnosed to death, it's called failure. Now, if we don't know the exact time of failure, then we call it census, as we have indicated. Now, I indicated to you that we can see this in health, economic, business, criminology. Now, this is how your data should look like. So anybody who is interested in survival analysis, essentially, I heard somebody saying he's doing biochemistry or so. In this case, the biochemistry nature, you may be interested in looking at perhaps some bacterials and the time they will survive on maybe certain diseases. You can do a survival analysis for them. Hello, is the person still around? Is still with us? The young lady who said she's doing.
Yes, please, I'm here.
You are there. So
Yeah.
you can do. Are you an undergrad or postgraduate?
Undergrad.
Wow, that's a good start. So there are so many things you can do. The molecular components. Sometimes you want to look at the cytokines, and you want to look at the levels of cytokine. So in a way, you look at the diseases, maybe SLG, and then you want to look at from which level to which level that can cause effects in the SLG. All these things are very powerful too. You can use survival analysis. I hope you know SLG, lupus, or it can be diabetes, any disease. So that's exactly what. So you can position your data like this. You can have your data because you want to do survival analysis. One, the source here is a demographic data or demographical data. And with this demographical data, we can as well have age, you can as well have occupation, education, marital status, religious affiliation. All these things are there. So at the end of the day, if you are doing survival curve, you look at it, the sex of the person, how does that influence the survival analysis? That is where the cost proportion model will come in to tell you what is exactly happening. But then you use the Meyer curve to then get the survival graph. So let me use this thing to illustrate the census I spoke about. So you see where there is red. What does it mean? What we are saying, if you look at this diagram critically, we are looking at hospitalization, okay, of certain diseases, but then the diagnosis of a cancer patient, whether when they were diagnosed, they died. Hello. So what is it happening? So if you are diagnosed and you died, it means you are what we call failure. In that sense, the survival analysis, you can be referred as what? Failure or survival time data. You can be referred to as what? Failure. Now, because the person died, we said yes. Yes means that the person is a failure. But if you go to the second item, the person never died, but we are looking at death. So it means that no. So what does it tell you? It means that you have even finished the entire event, or you are done with the event, yet the person has not died. So we call it censor. That's why we have put there. So diagnosis to steady ends, which is the death. The person did not die. That's why you can see the red. They did not die. So once it follows the right survival time period, we can also call it right census if the survival until the end steady ends. So, but if it doesn't, it's censored. Now, let's look at certain situations that can prevail. There are other varieties. A subject may be diagnosed before the study starts. Look at it. All the things we're looking at when you were diagnosed till the time you die, or you have been given school fees, when the school fees was given to you and the time you paid. Okay, the school fees was given to you, the time you paid. Or when they started launching investigation and the time you were caught. All these things are survival analysis, survival scenarios. So in this sense, if you look at it critically, there could be a situation where yes, indeed, they need to start the investigation and you need to be caught. But instead of them starting the investigation, you were caught. And one way or the other, you escaped. And then they catch you again. They started investigating you. And then one way or the other, you escaped. And they caught you again. And then they investigated you until the time they put you behind bars. Look at this scenario. You started investigation, you left, you've come back. So in survival analysis, there could be a gap. There might be a gap between the time the subject entered the study and the time the study ended. Suppose the patient was traveling and unable to be reached for a month in the middle of the study, but returned before the study end. There is a gap. So when that scenarios come, you should understand that gap and apply it accordingly. Then there is a delay entry. A subject may be diagnosed before the study starts, meaning they are at risk before we observe them. So sometimes this is what we do. Before the person comes, he has already been diagnosed. So if we are talking about malnutrition, he has already been diagnosed, and we go and start this our research, and then we diagnose this person again. You will see that this is what we call delay entry. So there could be a situation where delay entry, there could be a situation where there is there's a gap. So in that sense, we can have multiple failure. So at this point, we need to go to R and see if we can run some of them. Hello. So is there any questions so that we'll move to R? The theoretical aspect being explained. Is this something that you need clarification? I will do that. If you don't, we go to R. I will look for the data. Hello.
Hi.
So who has a question? Is there no question?
Please, excuse me, kindly throw more light briefly on the failure and then the sensor for me, please. I'm not
Yes.
getting it.
Okay, who again? Yes, who again? Okay, that's some. Okay, the one who asked the question, what do you do? What's your area of study?
Biochemistry, but now as a research assistant.
Biochemistry.
Yes, in molecular biology.
Oh, molecular biology.
Yes.
Okay, I just want to look at, so you deal with enzymes, right?
Yes, please.
Hello?
Yes, please.
Okay. Now, we want to do a survival analysis on enzymes. We want to look at the period, the time in which enzymes act on food and then is able to digest them. So the period of what enzyme acting and the period of what digestion. Now, the moment the enzymes act on the food, from that period to the time the enzymes will digest is what we call the failure period or the failure. In other words, if we are using the sensor, we will say it is the right sensor, right sensor, right sensor. But I didn't want to use because I'm using censored in this. So that period is what we call failure or right censored. But then sensors now comes in when the enzymes act on the food, but there is no digestion. You have finished the you have finished the study to know the time that the period the enzymes may have digested the food, yet the food is not digested. And so when that happens, we say it is censored or censored. Are you okay? So let's put it this way. Let me move there and come to the rare sense. The time, let's say you are an armed robber. We use an armed robber. The time the armed robber decides to go and rob, and the time the armed robber goes to rob. So from decision to robbing is that period. That's the survival time data. That is the period. And that period is what we called the failure. Or in other words, you say the right sensor. But listen, when the armed robber decides to rob and he goes to where he's supposed to rob, and you don't hear of the armed robber again, or what you have even finished, you have gone to where the armed robber is supposed to rob, and he's not seen any robbing. So in this case, you are unable to tell whether the armed robber was able to execute the task in which it was asked to execute. Or for example, maybe we are looking at bread making. The time you put the bread there and the time the bread goes into the oven for it to be cooked. Now here we have prepared the, what do you call it, the yeast and then the flour, and you put it into the oven. This bread does not get cooked. It goes on and on and on. You could have seen that even your fire, everything on the your oven, the what do you call it? The gas is even finished. Yet this bread is not cooked. So in that sense, because the bread is unable to follow the well-established time period, we call it censored. But when it's able to follow a situation where you put it in there and then it gets cooked, we call it failure, or in other words, we call it right censored. Is it clear, please?
Yes, please. I'm okay now. Thank you very much.
So is that all? We are okay? So let's now move on. Now, if you are working on survival analysis, what is important is your packages. So you need the survival, you need the survminer, tidyverse. I've brought the survival again, just forget about it. Then we need the Gene serve fit. This is the model, and that will be called cost proportion model. This is what you can use to fit the model. Okay, so this is the way you can fix the model with this. Fitting the model, survive fits. We have the survival, so the time, you need to get the status, you need to get the time period. In this sense, the example I gave you, if you look at the time and the status, let's go back. So the time is the dates, and then the status is the date. I hope it's clear. So in that case, when you go there, when you go to the data, we put that there. And then if you want to group, you want to look at the data in such a way that you want to know maybe the effect of gender on the survival, effect of maybe age, maybe education on survival, you do that. That's where the group may come in. The data is the name of the data set you have saved. So this one is called lung cancer. But I have a data that we'll use. Maybe we use the malnutrition, one of my students' data that I recently did for. Then the Google score plots, then you plot the graphs to know where the effect is. So you fit it, then you plot them. So at the end of the day, you would have the effect of whatever demographic you have on the survival curve or survival time. I hope it's clear. So this is how you fit the cause model. So we have the cause pH, and then we fix it. Let me say this, that as you see the models like that, depending on the package you use, some of the models will change. So get it at the back of your mind. If indeed you want to use this model, then of course you may look for package that will bring you the cause pH. So you see that the cause pH, we have the age, we have the sex. So we want to look at the effect of age and sex on the survival time. So that is exactly what we will do. But in terms of the risk prediction too, let me briefly go through the risk prediction. Then I will see how we can do some kind of R demonstration. So when we want to predict in health and in everywhere, if we want to predict the effect of enzymes on food, we can do prediction analysis. We want to predict in terms of whether it is true that the people who are diagnosed with diabetes are properly diagnosed. You can do a prediction for that. So all the diseases, you can do that. So prediction future health outcomes. So anytime we are doing prediction, we want to look at what is in the future. I mean, bring the insight of the future happenings. That is prediction. So you can use logistic regression in prediction, especially when you have the dichotomy variable or binary variable. Then ROC. Who can tell me the full meaning of ROC? Yes. Curves. Yes, who knows? Okay, so the ROC, as the name sounds, it's just a curve that will tell you how best the prediction is done in terms of specificity, in terms of sensitivity. So what you are saying, what you are saying to predict, is it that if you are saying that 50% of the patients, when tested, they were diabetic, is it true that they will be diabetic? So sensitivity analysis will come in. Then the specificity. Among the people whom you have been able to test to be diabetic, how many of them are correctly predicted? So these are the curves that shows you what is there. And then evaluating the predictive model. So at the end of the day, you need to evaluate whether the model you have churned out is good to go. So you have some parameters, AICs and what have you, to show whether it's good. The p-values, the robustness of the predictive models. Now, this is what you can do in doing predictive model. You need a generalized linear model. So in R, you should be able to get what we call distribution, and that distribution is binomial. That's why we are using. And again, because the model is a general linear model, and it's for prediction, can use the JLM. So we have the disease that you are predicting. This is how the predictive model looks like. The disease that you are predicting it on what? The age. You want to see the effect of the age. You want to see the effect of BMI, body mass index, then the person smoking. The data is what we call patient data. And which distribution are you looking at? Binomial distribution. Of course, you should know binomial distribution because we have failure and what? Success. And that's exactly what we are measuring. We want to say that at the end of the day, those who said they tested negative, are they really negative? And those who said they tested positive, are they really positive? That's why we have the sensitivity and then the specificity. Then you summarize the model. So in this case, what do you do? One of the application is readmission risk modeling. Sometimes people are admitted on a condition and then they are discharged. Then they come back and unfortunately they are admitted. Now with the model, you can do that, predict whether the person who has been discharged or in a way been healed can still be readmitted. You can use predictive model to do that. Cancer patient survivor, those who have survived, can we do a predictive model to know whether indeed the survival is really true or not? So the same way as cardiovascular events. So this is what indeed the predictive model can help us do in health. So at the end of the day, we can look at certain parameters that will help you. Sometimes they are the packages. So the key packages we would have looked at the survival analysis, the survminer, the RMS. So the R package, you can see the PROC. If you can do the ROC curve, you can use the package, this package. I don't know whether you know a package of carrots. You remember the forest plots, those model. You can have the forest plots model. So we can use the carrot to do the forest plots. So at the end of the day, this is where I found some of the information and I'm sharing with you. The Counselor Biostatistics, the R book, and then the R blogger. Thank you. I don't know whether there's a question on the predictive model. If there's a question, we can have it. Okay, let me look at share my R. Somebody has asked me a question I didn't see. Okay. Christy, do you have a question?
No, please. I was responding to your call.
That's okay.
Yeah, right.
Are you flowing?
Yes, please.
Okay. I don't know who is into public health.
Please, I'm here. Public health, epidemiology, and biostatistics.
I see. Who is that?
Jones, Tamale, UDS.
Oh, you are my student.
Yes, please.
Okay, I see. That's okay. Let's move on.
Thank you.
I'm also into public health. I'm a biostatistician. Thank you.
Wow. That's Alexander, right?
Yes, please.
Oh, where?
Kintampo Health Research Center.
Wow. Okay, so that's okay. Let's move on. So with that, let's see how we can do some kind of analysis. Where's my arrow? Is my arrow shared?
Yes, please.
Okay, so from our founder, yeah, he has done so many teachings, introductory course in R for you. So this training, I don't think would be a difficult thing. Again, too, if even it's difficult, you can still request for introductory course and he will take you through. So this, I don't really want to make R a difficult platform to learn. And as far as I'm concerned, I'm also a learner. So we would simplify it. So I want to upload my data. I am so archaic to the extent that in R, I have forgotten all my code. So what can I do? But I still want to have my data. So I'm going to File. Then when I went to File, I just want to import data sets. I will go. Then I asked myself, the data set, what exactly it is, the format it is. I think my format is in the Excel. So I will click on Excel. That is, I don't know how to code it, to bring it from wherever it is. You are good, you can just do it. But I still want to have it in a way, different way. Okay, so I haven't gotten that, I can browse it. Are you seeing it? Hello?
Yes. Yes.
Hello, yes.
It's clear, right?
Yes, please.
Yes.
Yeah. Where is my student's data? My first degree student who is doing survival analysis. Okay, I'm going to my desktop. I will look at my current project student, first degree people. I've seen it here, project 2025, because students. I think I have malnutrition, somebody working on malnutrition. What is it? Data. I've seen a data on malnutrition. I'm clicking it. Then I click it and see what will come. Wow. So we have this data. We have the patient ID, the age in man, gender, did malnutrition diagnosis to death. So this is what I spoke about. The person was diagnosed. I told the student to go and look for when malnutrition was diagnosed, and then whether the child died. So our failure is from diagnosed to death. And so you can see from this place that event status, okay, that is where the person died. That is the event. Now, survival time, that is the period, is D time. I've made it D time. So from days of malnutrition diagnosis to death, that will give me the time. So that is exactly what we have done. And then we have other variables. We have age, we have gender, we have nutritional status, we have the birth weight of the child. We also have the gestational age. Gestational age. We also have the maternal health. Please, I'm in the office, come. I'm in the office, come. Maternal health. Then the post-treatment complication. Some of them, we never saw them died. They were treated, but along the line, they had complications. So we wanted to know how many of them, yes or no. So that is what the student wanted to know. This is a rich data. She went herself to collect this data. You can easily do that. Then having done that, I would import it. So in R, the moment you do importation, remember the environment. So you can see your environment, the data. So what happens at the console, the display. Then we have your library, or where you can look at the packages and what have you. So there are 4 main streams or platform in R, especially when you are using what we call the R Studio. And then we have the view where you can execute the commands. So what commands do we need? I have told you that in R, if you want to start R in survival analysis, there are some packages you want to use. So these are the packages I have here. I don't know whether it has been done. It's a long time I used my R, but let's see if we can do the packages. Still, I am a local person, so I will go to install and then enter my first package, that is tidyverse. Who knows what tidyverse is used for?
Yeah, that is for the data cleaning and the processing, as well as graphical display. I think it comes with the GG plots too.
Yes, the GG plot. Yes. Okay. So now knowing my okay. It's a long time. I should have updated. Okay, good. But let me do update and see something. Forgive me, it's a long time. I just want to do updates. What we are talking about here is simply or simple. One, you need to get your survival analysis data. where you look at the failure or you look at the right sensors, you know the events, and then you are easy to go. Now, I don't know the areas, but I want you, in order for participatory learning, because as for online studies, you will soon see that the person has just hooked on and is sleeping or doing his own thing. So what I want you to do now is go back to the chat box, kindly give me some topic or example that fits survival analysis. Yes, I'm looking at it. Hello, are you doing that? Who has put it there? I'm just observing. Just give me an example of survival analysis we can easily relate with in your field. In your field, not in any other field. And what is in your mind you want to do? I'm waiting. Nobody is typing. Okay, bladder cancer patient from time of surgery to time of, wow. That's a very nice one. This one is if you can get the data, fine, but it may be a clinical trial. Yeah, shingles infection in children. Wow. Yes, who again? These are how you get your topics and you work with them. Testing antimicrobial susceptibility of different microbes. Okay, susceptibility. So the time they will be susceptible. Good. Here we again. Okay, so those of you who have come up with something, yeah, okay with you. So I have installed, what I can do is to put it at the library. It's there. Then survival. Let me put the survival to check the survival. This is a basic way of doing it. As you grow in R, you would have a very good way of handling it. I hope you can see what I'm doing.
Yes, please.
Okay. So it seems to me I've been able to do the tidy first. So many of them have come along. See, when it comes to the package, you have several of them packed there. That's why it's a package. So we have gotten so many of them. Okay, so now, having been able to install your packages, what do you do again? I have told you, you need to define your data, you need to have the event, you need to have the sensor, and we need to have the survival time. So the data we have is called data malnutrition. So what do? We need to be able to tell whether if the event happened, it is what? Yes, 1. If it doesn't happen, it is what? 0. So that must be taken into consideration. So first, you design your unique variables. So in survival analysis, you need to define your unique variables. And the unique variable is the event status. The event status is what? That is where the event, in ours, it is the event, whether the person was died or not. So we can easily run that, okay? I have done the coding. I did it for my students. So that is what I want to. So after that, I can still give it to you. When you have a data, you just change it. That's the most, exciting part of R. Now, what is happening? Yes, the data, I can check the data file too. So I use this to check the data file, the head, and the table. These are nothing more. And then we have the head of we can look at how the data looks like, okay? So the headings and what we have, these are all in the data. You can just look at it, and these are descriptive things you can look at. This is not anything, you just choose to do it. Then you can have the table of the status. So you can see that the table of the status, what does it mean? We wanted to know how many people say died, how many people didn't die. Hello, I hope it's clear.
Yes, please.
So in our sense, how many do we have? We have 20 who died and 1 who didn't die, right? Can you see that? Oh, is that the data? Okay. Now, time to event. We can use the D time. The time to event, you remember, when did we start the event? When did we start the diagnosis? And at what point did we end at the event? So the time, we call it time to event. And in our data, we have it as what? D time. If you go there, you will see. So this is the D time. You can see it there. And this is the status. Oh, the status is more than 1. How come it was 1 I saw? Oh, sorry. I didn't read it well. Those who were censored, let me put it that way. Or in other words, they were 20. Those who died were 100. So that's exactly what I want to talk about. Good, let's move on. Let's move on. Now, the time to event, we will define it. Is that not the case? So this is how we will define it. In any of survival analysis, make sure you should be able to define your event. You should be able to define your time to events. So you should know which one represents what. So I would also, in a way, run it and it is telling me these are sorry. Okay. So we can see that in terms of the time to event, these are values you can see. 190, these are all there. What do we do again? There is what we called the year or month. Are we dealing in years or are we dealing in what? Months. This one, I think we are dealing with years. But if indeed your data is in month, you need to change it into years. So this command, data more nutrition, which is equal to the data more nutrition, the data, you see the symbol, the percentage, greater than, less than, some mutation. So we are doing some division, manipulations there. But for our data, it is the same, so we wouldn't do that. It is in years already. So if your data is in month, you can use it. If it is in days, you can convert it into years, only if you want it. So then I move on to what we called, we need to calculate what we called time to event from dates. What this means is that sometimes the time to event, it is not given straight ahead. For instance, let's go back to the data. You see that we have the date malnutrition diagnosis and we have date death. What this means is that if you don't have the time, the D time, which would be the time to dates, if you don't have that, you need to calculate it in your analysis. So the code there is to help you calculate that if you don't have it. So this code here would help you calculate that, and you can use the head to show what has happened. Okay, but ours we have already calculated, so we don't need that. I just brought in so that when you have a data shortfall of that, you should be able to do it. So you can see that this is the formula we have used. We can use this thing to do that calculation. And we have the data dot frame. You remember in R, your frame is very important depending on what you are doing. So sometimes we bring it in to be able to help us execute what we want to achieve. Now, having done that, we now come to how we can create a survival object. Now we have our what? We have our event. We have our event to time. We have the time to date. So how can we create it so that we can have survival, graph or data? So this is what we will do. So the first survival curve we will do is to use the survfit. You remember the survfit, right? No, we create the survivor first. So we use the sub object, sub time, the data, d time, and the event is what? Data mod, that is, the event is the status. Okay, the event is the status. So let's have this and run it. So this is how you can create a survival curve. But so this is how you can create a survival object. Before we finish the object, then we come to the curve. So the survival object is to introduce in the event and introduce in the time to dates. So this is how you use the package. You remember the package we were using? So we use that. And then we fit it with this model. This is the name of the model we want to have. This is the survive from the survival package we used. And then we bring in the time. This is the time. The time means that the time to what date. We are taking it from the data set, data malnutrition. And then we have what we call the event, as we have also classified. We are taking it from what? Data malnutrition status. Then we run it to have our survival object. Then we run. Then let's see what the survival object is we can have. So at the end of the day, we know we are having survival object of we have survival object of those who are 197, 206, 205, 57, and what have you. So we have those ones in place. But then let's go and do our survival analysis or curve to know what is happening in our data. So having created the object, so first of all, you need to create the object. Having created the object, then it gives you the opportunity to now run what we call the Kaplan-Meier. Please, who can tell me, put it on the chat box, what we can use the Kaplan measure for, and what does it show? Yes, the lectures I gave. What can we show? Yes. Hello. I'm not seeing anything. Are you part of us?
Yeah, hello.
So tell me.
Yeah, please, it shows the survival curve.
The survival curve. So at the end of the day, we want to know how the nature and the trend of the survival. Okay, and very good, very good. Somebody is asking whether we can have the link to the data. This is my student data. I don't have that right to give it out, but I can get you a simulated data for your practice. I can ask for the code. I have every right because he didn't write. I wrote it. Hello, who is that? Courage. Did you hear me?
Yes, please. Yes, please.
So I'm pleading with you. This data is
okay.
The student.
Yeah, I do understand. I do understand.
Okay.
But I'm following along. So
good. That is what I want you to do. Good. So now let's see how we can create a survival curve. Now my first model, which is the survival curve, I've named it S1. I'm using you remember we had the package. So out of the package, we have the solve fit. You remember the solve fit. Now, I am bringing in the survival object I have created, that is sub-object, which is equals to 1. The data is what? Malnutrition. So that alone should be able to get me my survival curve. So I just put it there and run. You know the run. So I have it there here. It has picked. Now the question is, let me see the summary. What can I see? I will see the summary of that model. This is the model. Now, when you have this, then another thing comes in. You should be an eye of an analytical. You should have analytical eye. Analytical eye. And the analytical eye is telling you something here. One, it says at time T, what is happening? It seems there is a high level of what? So I've seen that somebody wants to answer it. Okay, let me say something before you come in. I'm seeing that at time 0, when we have not even started any event, we just at time 0 diagnosis, we are about to diagnose. We will see that there is a high survival rate. Can you see that? 0.999, high survival rates. Now, when we move to maybe years, 14 years, we could see that it is reducing. Can you see that? 24 years is reducing. So this is how we analyze it. Then when we get to the point where we have the time to be 99, then we have 100 and something. You can see that the survival is what? Decreasing at a point. So you can see from the probability, this is where you would use to then tell whether you have a survival increasing or decreasing. So 99, 99, 98, 97, 89, up to where? Up to 0.69. So it has reduced up to that point. But what is important is that how many people were at a risk? Hello. At the point when we were at the time of 289, there were 10 people at risk. Go and look at the top there is what? Number at risk. That is risk. There are 10 people at risk. And at that point, their survival rate was 69%. Have you seen how this dynamic is? If you are following what I'm doing, it gives me a thumbs up. Hello, those who are following, please give me a thumbs up. Thumbs up. If you are not following, I will go back. So it gives me a thumbs up. Treasure. Your name is Treasure, but I don't know what you are following. Is it something you are following, Treasure? Hello. Hey, only one person is following. Okay, Courage is following. Alexander is also following. Oh, majority of you are not following. So what are your challenge? So I'm listening. Those who are not following, just tell me. We will soon finish because myself, I am behind time. Yes. Theophilus, Zuma.
Sir,
I guess you are not following. So what is the challenge?
I reacted or it didn't so.
You said?
I reacted, please.
Oh, is that so? I couldn't see it, so that's okay if you reacted. Okay. Maybe Francis, you can check if they are reacting or not. Okay, good. Let's move on.
Okay,
now,
I'm doing that.
Yeah, Francis, you can do that. Now I have been able to pick up my survival at every point in time. I know how many people are at risk and of what percentage. So it's very important. This is one of the things you should do. Now, I need the plot to see how the steps are in terms of reduction or not. So how do I then plot it? Okay, so what I can do is now get my Mesa plots, Kaplan-Meier plots. It's a popular thing. Anybody who is into survival analysis know this man. So I want to plot, I've given it a name, KM underscore curve. I'm using the Gene sulfates, the graphical representation. I have the line width and what have you. These are graphical. Those who are in R would understand how the graphs we do. So if you don't even understand, get the, what do you call it? Get the course and also be doing it yourself. Okay, good. Let's move on. Then we have the confidence interval, the risk table, scale, and what have you. So let me run it. I have the limit to be 0.8. So just get that point. The R, the S axis, the limit to be 0.8. When I run this, what happens? I haven't run it. I need to draw the curve, right? Okay, draw the curve. Wow, I think the curve has come. Oh, is that my curve? Okay, let me export it and see. Save the image. So I'm seeing this curve. This data, let me enlarge it and see. 400, maybe 800. 800.
Doctor, please, I think you could also click on the zoom button and you could zoom by clicking on that zoom icon there. That would be best.
You want me to click on the zoom button? You want me to click on the zoom button? I
Yes.
wanted to show them how to save. That's it.
Oh, okay.
But that is how you save it. If you have it and you think you need to enlarge it, the steps I went through, you can do that. So you can see from this overall survival and then the years. At the beginning, where we have the 100, the time was beginning. We begin at 0. You will see that 100 people, the survival rate was 100%. Then as it moves on, it decreases. Okay, so you can see a decrease. At 1, there is a decrease in survival rate. And it goes, there's a decrease at 2. You will see that it decreased. But of course, if you look at this, it is a very good survival. It's at the top there. So the decrease is not much, as you can see here. The nature of data, the data we have. The suggestion that came, you can zoom it to. Okay. You can zoom it. Oh, where did I put it? So this can be zoomed, and you can see how the zoom tool is like. So please, if you have it, this is the nature of the data. That is why you can see this. But in a way, it is a stepwise, like the steps. You can see how it is decreasing. But because the data, the survival rate is high, you can see that they are ranging right up to 80. Good. Now let's move on. So we now know how to do the Kaplan-Meier. Okay, we use this. When I saw that the graph was this, I tried something else. Let me use it and see. Good, this one was okay. You know why I didn't make it 8, but I make it maximum in terms of the limit, X limit, okay? So you can also choose this one. When I did that and it was giving me that narrow escape, I needed to have expanded my X to cater for maximum. And so I use this. So this one too, this is how it is. So you see that this looks nicer. Can't you see that? So at the end of the day, I can boldly say that. So it means that I'm not using the 8 and what have you. At the time or the 300 days, what is happening? Person survival rate is less than 75. At 200 days, the person survival rate is a little above 75. So that is how we were handling that. I hope it's clear. The shaking, the zigzag means that there are some spaces in between, or there are numbers in between. So just get it that. I hope it's clear. So let's move on. Having done your Kaplan-Meier curve, you need to move on. And how do you move on? Can we look at survival beyond certain number of days? So I said that maybe I can look at survival beyond certain number of days and see what is happening. So if I want survival, I can specifically tell maybe this day, maybe at day 0, at day 0.5 days, day 2 days, 5 days, 7. What are the survival rates? So you can see that I can easily. So somebody may ask you a question. You said you want to look at infection rates. And so at the point where the child is maybe having infection rate of this, or surviving with an infection rate of this, of what percentage will it be survival? Then you should maybe get the actual day at day 3. What will be the survival rate of a child that is having an infection? Then you should type in the day and know which survival rate is that. So that is exactly, you can see the survival rate of 0 is 9.99, 0.99 up onwards. All these things were good. I did that, especially I brought in colors and what have you. So you can also look at them if you get the codes. If only your Francis tell me to give it to you, I will give it to you. So I've shown with lines, depict at every point what is happening. Okay. I hope it's clear. So do you know, let me show you this too. Do you know what the shaded portion, what is it? Who can tell me? Yes, who can tell me the shaded portion? Hello? Okay, the shaded portion is the confidence interval. The shaded portion is the confidence interval. So at the end of the day, you could see that your survival rate fall within the confidence interval. Very good. So if you are explaining, you should be explaining well. Now, I made a point to here. I just want you to understand that. Look at this. Now, somebody, can you see the risk and can you see the event? Hello? You can do the analysis like this and show the risks and events. The latter part I did. You will see that at event 1, where the person, we had how many people? 120 people being at risk. So at a point that 100 days, where we have 100 days, there are how many people at risk? 50 people at risk, and it will be at the event 16. Then we have 231 at risk, and it goes on and on and on. You can depict this risk graphs to buttress your Kaplan-Meier. This one, you use this curve with the line band and the dash column. Good. So I think that one displays enough. Let me go to how best we can now use what we call the curve proportion. Now, if you use the curve proportion, we want to look at whether maybe maternal health has influence in the survival analysis or curve, gender, post-treatment complication, and nutrition status. Now, what do? I can use the log rank test. I'm using the log rank test because of the package I used. Other than that, I would have used the curve pH. Hello? So in this case, what I need to do is to look at my data. I can just look at my data, find data, know maternal health, what entails. So you look at maternal health, complication is 19, health is what? 101. We look at gender. Females are what? Females are 57, males are 63. Then I look at what? Complication. Complication, how many people were having complication? One, only one person. But the rest, no complication. Good. Then nutritional status. So those who are the MAM, they are the people malnutritionists, and then the people with very good status. Okay. Now, having done that, I need to fix my model. How do I fix my model? I'll first of all fix my model using, want to know whether health post-treatment complication affect the survival rate. So, whenever we are talking about what affect what, we use what we call the corpse proportion. But of course, the corpse proportion, you can use a package that has a curve pH. But per the package we are using, we are not using the curve because we are using the survminer and then the JJ subfits. So that is why you couldn't see the curve that I told you earlier. So we need to understand that. Though I have written it down, but I didn't use that one. But it can be used. So that's now another. So we are in module 2. We have finished with module 1. So in your presentation, you will start from module 1, then module 2, you present it. So in this sense, let me explain the model for you. We are still using the subfits. This is the survival object. What is this? Survival object being equals to the post-treatment complications. Then what data are we looking at? Data is malnutrition. Then we are saying that it needs to draw what we call. After that, we will use the JJ subplot to draw S2 data malnutrition. Then we are giving it a size. What we have, we need to draw it. That is it is what do you call it? Measure part of the survival analysis, and we give some coded information here. This will be given. Then the sensor shape 1, sensor size 4, all these things must be given. The p-value, we need a p-value, we need a risk table. With the risk table, we need to structure it. Then we need a graph, which is legend. All these things, we need to show what exactly. So we are saying that our 0 should be no, 1 should be yes. So that is how we have labeled our data. And then we run it. So let's so we run this first. Having run this, then we run the entire graph to depict it. Where is my this thing? I'm not seeing it. Okay, I'm coming. The JJ spot, let me write it there. Unfortunately, I have deleted it. Let me write it. I wrote it here. Let me copy. I did I think a certain mistake. So JJ plots data and I run it. Okay, and you can see it. Let me zoom it. Yes, what do you see? In the same vein, we said we needed a p-value, right? Hello. So you see that, yes, the structure we did. Good. The structure we did will tell you if it is yellow, it is what? No. Blue is what? Yes. Now, if we come here, look at the p-value. The p-value is 0.61. This is telling you that in terms of post-treatment or post-condition, is that not the case? Yes. It is not significant. So post-treatment has no effect on what? The survival analysis. Though we can see those with yes at risk is 109. Those who were not at post, what we call the treatment, they were how many? They were how many? The post complication. You can see that those that are saying yes is who are not post condition. They were 19, and then those who are post condition at the 0 point they were 1. At 100, those condition, who were not conditioned, 90, post-condition is 49, and those who were 111. So you could see that more of them, the risk were more with those without post-condition, but it is not what? Significant. Then I will run to see which of them would have influence on our survival. I think I have what we call gender. I want to run gender and see. So when I run the gender, can you see the gender too? So gender 2, the graph is not significant, but you can see the differences. They are matching. You can see that whilst 55 females were at risk, 63 were also at risk, males. So at 102, whilst 24 were at risk, 26. So the males were suffering, except at the point at day 200 where there were more females at risk than the males. And that should tell you. And this is the, what do you call it? This is the coefficient. There's confidence interval. So that is, then I want to see which one is significant, because a long time I ran for them. I want to see which one is significant. Then we talk about it. So we are about to close. Wow, I think this one is significant. Wow. Can you see it? So it means that complication, whether the person, in terms of maternal health, the health of the mother, in terms of the health of the mother, you can see that wow, the health of the mother, you can see that it's significant. It affects the survival risk. So how is it affect the survival risk? We'll see that at a point where we have the 0 day, those who are complicated, 19, they are risk. The mothers, 19 of them were at risk, and 101 were not. And it follows like that. So this is a very good pattern you can illustrate from your survival analysis. Now let's move on to the last one. We can do that and then we finish. I don't want to do it. So now I'm going to run the models too. You can use that one to explain, but you can have this model to see. Oh, the status. The status is event. We've not put it there. So we cannot use that. It must be the event. Maybe this one. Or this one, we need to clear it. This one will not clear because we need to use the proper event. If you don't do that, you get it wrong. Okay, so now let's come to the course regression, the course fitting the course model too. We have done it here. I hope it works. Let me check whether everything is there. Survival time, status. The status. Or let's go back and use the status event because if you say status, it won't work. Like what we did here. Where we have this the data malnutritionist. Okay, it should have worked. Okay. Okay, so let me cross-check and see where the problem is. The corpse survivor. We need to ensure that we have put in the corpse pH there. Other than that, it won't work. pH. Other than that, it will not work. So you see, you need to do that installation for survival analysis. And as it stands now, because we have not done the package, it's not picking up. So when it gets, you get this thing, you also do the installation. And it must be able to pick. But what we are doing, what I wanted to do here is to run a model that the model will tell you how many of them are significant and how many of them are not significant. But with what we used, the plot we did with the various variable in terms of the demographic characteristics, that all is enough to tell you that. So we may even not be much interested in this corpse reps. Maybe if I say I want to fix it, will give me it will delay my time. So I want to bring the lectures to an end. Maybe in appropriate time, we'll continue with the prediction models, how to do prediction model. I don't know if there are questions. If there are no questions, I want to bring the curtains to a close. Francis?
Yes, Doc.
I don't know whether they would ask questions. If I want to, because I need to go somewhere. I don't want to fix that.
So the questions, maybe they can probably put it on the page so that later we'll respond to it. And also we'll work on the recordings and also share it with them.
Of course. I think it's even the recording, they can see the codes in there. So it's good.
Yeah, they can see the codes in there and stuffs.
Yeah. So I think I want to thank you, Cameroonians. I want to thank you for your time organizing this program for me to speak. It's all about R in health, and we have looked at survival analysis and then predictive models. But of course, the predictive models, I was unable to do much. I was only giving you the theories. But I think that the survival analysis, I was able to go hit to toe with that. And with whatever, I intentionally made each of you to write what we called example of topic you can look at it. So those in biochemistry you did, molecular biology you've written. So go and do this research. It will help you. If there's any problem, you can just contact Francis, you get to me. On that note, I thank you all. Thank you very much. Thank you very much. Francis, over to you.
Thank you, Doc. Thank you, Doc, for an interactive session. We've seen that you've done something different. And I think the other communities also learn from that. You've taken us through the theory aspect and also you did the practical as well. And this is what the the other communities we have not been doing. We only go straight to the practical sessions to just help the participants. Thank you very much for your time. I know it's not easy. Today is Monday. Everybody is normally busy on Monday. Sorry, today is Tuesday. So today, because of the schedules and stuffs, but I want to thank everyone for joining. And then we'll share the recordings, as I said, on the page. We have another meetup coming on. That will be on the, I think, in somewhere September. Yes, September, with George. He'll be taking us through our sending your files to GitHub. He'll take you through GitHub and R. And then I think we have another last one, which will be in December. Should be Professor Godwin from the US. So we'll be updating the page on those things. And also we'll be planning for our conference to next year. So we'll still update members on that. We also have our mentorship training, which will be starting next month. The next week, Thursday, we'll start in Google. So those who still want to be part of the training, kindly let us know so that we'll add you to the training. On this note, thank you very much, Doc. Thank you, Cameroon Research Community. Thank you, Avo, for the congratulations. You told me that you get back to me again. I think he just left for a meeting. He's with UN. He works with the UN, and they're having some meetings, so he has to leave. But I want to thank the other members from Cameroon Research Community for joining. Thank you very much. And then we'll keep you updated on our page and also on our linking pages and our website. Okay, at this note, thank you very much. Any member want to say anything, any contribution? Okay. Okay, so on this note, we would like to end the meeting. Okay, thank you very much. Thank you, Doc. Thank you, everyone. Okay, bye-bye.